We all know medical care in America is expensive. What you may not know is that it costs us all much more than it needs to. How much more, you wonder? I'm glad you asked. According to the American Medical Association, Americans spend more than $7 billion a year too much for medical care. Where does all that waste come from, and why does it happen? The short answer? Simple human error. Here's how it happens. Doctors and hospitals help us when we get sick or hurt, and we depend upon and appreciate their great care. These medical care providers are experts at what they do, but they face an extremely complex payment system when it comes time for them to send their bill to any health insurance plan. In fact, there are nearly 150,000 treatment and diagnostic codes doctors must pick from every time they create a bill for payment by any health insurance plan. Because of the complexity of this government-mandated billing system, doctors and hospitals don't always get it right. Sometimes they get these codes wrong, which makes their bill wrong. Although we've all heard stories about medical service providers who have billed too much intentionally, most of the time such improper billings are merely the result of human error. Not to worry. Once a doctor or hospital submits their medical bill or claim to a health plan, the claim is fully reviewed for accuracy by the plan's claim administrator, who does a very good job making sure these bills are paid correctly. In fact, administrators pay between 92 and 98% of all medical bills they receive correctly. This is an amazingly high quality of service which requires the collaboration of computer software, expert personnel, and third-party claim review services, all working together quickly to handle more than 12 billion healthcare transactions occurring each year in the United States. 92 to 98% correct. Stated another way, this means 2 to 8% of all paid claims have some error, and this is where Americans waste $7 billion every year paying for $2.7 trillion in medical care. So, what is the solution? Claim return is the solution. 150 million Americans are covered by health insurance, and of those, about a third, or 50 million people, receive benefits through self-insured group plans provided by their employer or union. Claim Return works with these self-insured plans and their claims administrators to identify and return their portion of this $7 billion in annual waste. How do we do it? Claim Return uses our patent-pending leading-edge technology systems and industry experts to review each line item of every bill presented before it's paid, after it's paid, or both, in order to identify improper bills, inappropriate overpayments, or payments for services that were never provided, to prevent or recoup overpaid dollars and return them to self-insured health plans and their member employees. In addition to returning these dollars to self-insured groups, Claim Return consults and educates medical providers, self-insured plans, and claims administrators how to avoid similar mistakes and significantly reduce future costs. To find out how to claim your return, contact us today, toll-free at 1-800-7-CLAIM-9. That's 1-800-725-2469. Email us at info@claimreturn.com or visit us online at claimreturn.com.